Hello, everyone. Ty Kimes here, your Missouri Blue Star Families Chapter Director. I am here with Tea with Ty. So I've got my tea today. Actually, I'm going to be honest with you and tell you I'm sipping on water in my fancy teacup today. So sometimes you got to switch it up. So I've got a little bit of water that I am drinking on, sipping on, and I am super excited today because we're talking about something that's really, really important to absolutely every military person out there, whether you're still active duty, currently active, or whether you are a veteran like myself, or whether you're a spouse, also like myself, right? So if you are military connected in any way, shape, or form, and you are using Tricare, this topic today is something you want to tune in today because we are going to leave you with 5 pharmaceutical benefits you should know as a Tricare beneficiary. Today, I am joined by Miss Rochelle Tumlinson. Did I say that correct?
Yeah,
Had
Tumlinson.
to, had to slow it down a little bit. I'm so glad that you're joining us today. So you are
Thank
the
you.
product manager, you are the senior advisor, and you're over at Express Scripts. So thank you for joining us today.
Thank you for having me.
Yay. So I know, Rochelle, so you are from Arizona, correct? Born and
I
raised?
am
What's that
born and
even
raised.
like? What's it even?
Hot.
I've never been there.
It's hot.
It's hot.
It is, but I think we suffer in the summer to have those great winters. Although I have very thin blood, so anything below 70 degrees, I'm freezing and need a sweater or a parka. So yeah, it's really nice though on those off seasons. Summer is brutal, but I've been here all my life, so this is all I know.
I love it. I love it. I love it. Being a military brat and like traveling like all over, attending 9 different schools, it's hard to know what that's like. But I'm always like excited. Like, tell me more about what's it like to like have a hometown because military families we don't all get that. So
Yeah,
I'm
no,
so
it's
glad.
It's definitely crazy, but yeah, you don't find a lot of Phoenicians also, like people that have been born and raised here and still live here. There's not a lot of us, so definitely interesting.
Well, that's good. I'm sure you still make time to travel, so that's fantastic. And you have 3 kids. You've got one who's 22, 19, and 12, and you have 3 stepsons, your bonus sons, ages 16, 14, and 13, right? And you've been with
Yes.
Express Scripts for 19 years. That's amazing.
Yeah, thank you. This will be my 19th year.
Wow. And then you've been servicing the TRICARE pharmacy benefit in some capacity since 2003. So that's
Yes.
also awesome.
Yeah, no, I have when I first started with Express Scripts, it was, bringing on that new TRICARE pharmacy contract. And so that's what I was hired for. And I started out just entering prescriptions. And so I've moved up and now have this pretty little product that we're going to discuss today. But yeah, it's definitely been a journey and I love it.
I'm glad. And I'm glad that you're here to tell us more about CIGNA and Express Scripts because some people may see that it's kind of tied in now. Do you want to kind of explain what that's about for our viewers?
Yeah, so Express Scripts has been around since 1986, and in 2018 we have merged with CIGNA. Well, CIGNA had purchased Express Scripts, and so now we are merged, and that's just to improve the affordability, choice, and predictability of healthcare for our patients and our beneficiaries. So definitely opening up that book of the medical and pharmacy and putting it all together.
I love that. And we're excited to have you support or CIGNA and Express Scripts support Blue Star Families of Missouri. So we thank you for that partnership and the support as well. So I'm so glad that you're here to give us information about it. So tell us what's so important about what you do, like what your job.
Yeah, so over this past year, I have moved over to the beneficiary experience team. Prior to that, I was on the MTF account team, so the military treatment facility account team. That was fun. I did enjoy that job. I got to travel to a lot of the different sites out there and educate the beneficiaries and the providers on the pharmacy benefit. A lot of the, the active duty members and those families, they don't really understand what we do for them. And so it was definitely important to get out there and get in front of some of those people and let them know, that you have this benefit and what it entails and the convenience of home delivery. And so it's definitely an important job, and I do love it. I do love talking with those beneficiaries and those providers. And now on the beneficiary experience team, just, really elevating that beneficiary experience on our website tools and their communication and interactions with our call centers, and just elevating that experience.
That's really good. And so you talked about like the beneficiary experience. And I think, because I'm prior service as well, I grew up as a military brat and, even kind of now, as a military spouse and on the retired side, I don't think it's something that I really truly thought about, especially while I was active duty, like my benefits, of being a Tricare beneficiary. And so once we became on the retired side, it definitely was something that we really looked more into, like, wow, okay, so there are a lot of benefits with sticking with Tricare. There are a lot of benefits that carry over. And I know today we're talking about that 5 pharmaceutical benefits that everyone should know as a Tricare beneficiary. What do you think would be a good number 1?
Yeah, so the number 1 I want to talk about today is the formulary search tool. So being a Tricare beneficiary, you have this tool that's accessible to you. It's a digital tool, it's online. You can go in and you can see what medications are covered, where they're covered at, and what your copay would be. So we have the military pharmacies, we have the home delivery pharmacy, as well as the retail pharmacy. So you can look up one drug and you can get information for all 3 pharmacies. And it'll tell you, whether the medication's covered, if there's a prior authorization that's required, if it's a medical necessity drug, and what that copay will be assessed based on the point of service that you pick up that medication from.
That's really good to know. And we've got the website down there on the bottom. They express / or dash, it's not a slash, it's a dash, scripts.com / T-form. So for those of you that are interested in wanting to have more information and just check it out, because it's a benefit there. So definitely check it out. The link is there for you. And of course, we're going to add that in the comment section so you don't have to look for it later. So, okay, so that's a good number 1, a good number 1. And anything else you can share about the formulary search tool? Anything?
Yeah, so like I said, it has a lot of information. So don't be overwhelmed. You put in your information and you look at, there's some links on there that will tell you, any coverage rules and where you can get it from. We also indicate specialty medications. So there are some specialty drugs for some advanced disease states that you can also look up and get some information on where to get those drugs, where they're available from. So definitely an important tool to look at what's covered, and if it's not covered medication. The other great thing is if it's not a covered medication, you can actually, there's links on there that will tell you what is covered and give you that pricing information and coverage rules as well.
It's really good. So again, this is just another tool for us to kind of get on there and check out. And I have to be honest, I didn't even know about it. I'm like, oh, okay, so there's this new thing. So I'm definitely going to get in there and use that for my husband and his medicine, as well as for me and my kids. So it's really good. So what about other benefits? And you think about, like, since we want to have 5 pharmaceutical benefits that you should know. So we've got 1. What are some others?
So the next one that I want to highlight on is the home delivery benefit. So this is a benefit where Tricare beneficiary can receive their medication right to their door for a 90-day supply for 1 copay. This is really great for your maintenance medications, something that you're constantly taking. Your doctor's probably not going to switch it up too much. So definitely look into that home delivery benefit. You'll get the 90-day supply for the 1 copay versus going to a retail pharmacy where you will pay a copay every 30 days. So definitely convenient, more cost savings, and it's a really great benefit.
That is a good benefit.
Yeah.
Do we have any others?
Sure. So the retail pharmacy is also part of that benefit. So the beneficiary can definitely go to the retail pharmacy. They can get their acute medication. So more than likely their antibiotics or something that you get, when you get a nasty sinus infection or something, you can take it to the retail pharmacy and get that prescription. There's over 56,000 retail pharmacies in network, so finding one shouldn't be an issue. And you can always look at the militaryrx.com website if you want to look for a retail pharmacy near you.
Awesome. And I think that's good because, everyone's on vacation right now. And then not only that, military, we travel and PCS all the time. So
Absolutely.
I think it's really important to know that you have that linked. Can you mention that website one more time?
Yeah, so it's www.militaryrx.express-scripts.com.
All right, I'm going to type it in and then I'm going to have it pull up.
Okay.
So hopefully I've got it correct. Let's see. Is that it?
Perfect.
Woohoo! Okay, so there's another site for you, all beneficiaries, to kind of go and check that out. So,
absolutely.
Okay, so we've got 3 good tips. What about, can you give us 2 more?
I can.
Okay.
So the next one, so speaking of retail pharmacies, the next tip that I can give you is that the Tricare beneficiaries can get covered vaccinations at a zero copay at participating retail pharmacies. So typically no appointment is necessary and you just go in and you get the vaccination right then and there. And you can also look for those vaccinations and what's covered at those retail pharmacies on the formulary search tool. So you can go in and put in like the shingles vaccine or the flu vaccine. You can look up any of those and it'll tell you, where it's covered at and what's covered.
That's really good. I'm glad you mentioned the vaccine stuff too, because going back to school, there's some vaccine requirements for those that are in public school. And not only that, people are still looking at where they can go to get the COVID vaccine. So that's
absolutely.
Really
that was another point I was going to bring up. So the COVID vaccinations will also be on the formulary search tool and it'll let you know, what pharmacies, the retail pharmacies you can go to get those.
Yeah, so definitely. And I'm going to show that formulary search tool again. So there is the website to go for that. So, okay, you have another good one for us?
Yeah, so being a mail order pharmacy, there's some concerns, right? You go to the retail pharmacy and you talk to your pharmacist. If you have any questions on your medication, well, at Express Scripts, we have 24/7 access to a pharmacist. So anytime you have a question about your medication, if it's a new prescription and you're not really sure, how to take it, you can always call us and we'll have a pharmacist go over that information with you. That's 24/7 access. And besides the pharmacist, you can always call us to get more information about your benefit, to check on your order status. You can call us anytime you want, and we'll let you know what's going on with your prescriptions. You need to talk to a pharmacist. We've got it.
I love that. And I think that it's so good that you're so willing to kind of help, because there are oftentimes many questions about the medicines and things of that nature, especially like if you're a caregiver, which I'm a caregiver, I check a lot of box,
Yes.
And so if I have questions about my husband's medication and things that I should know, or even like as a parent, things that you should know, really for you, maybe, you're just wanting more details about that. So I think that that's great that you make it easy that we can either go to that website, to check it out, or that we can give you guys a call.
Yes.
It's really good. Really good. So are there any other benefits that you'd like to mention that maybe didn't make your top 5 today?
No, I think we've covered everything. The one thing that I did add in was those specialty medications. That is really, a lot of people don't know a lot about those medications unless they're taking them. So, and because they are so outside of the box, a lot of people may not know that we have information, and we do call out some of those medications on that formulary search tool and give you some extra needed information for those drugs.
That's really good. So, hey, you guys have heard it here. Your 5 pharmaceutical benefits that you should know as a Tricare beneficiary. So definitely check out those websites, check out those links. and make sure that you're taking advantage, no matter where you're at, no matter if you're in Missouri, if you're traveling to Florida, if you're in Arizona, definitely look and check that out. So, Rochelle, can you tell me, like, so I'm excited and grateful to have the support of CIGNA and Express Scripts. How does the staff feel about supporting military families through Blue Star families?
Yeah, no. So our team is dedicated to helping Tricare beneficiaries just understand their benefits and reduce those out-of-pocket costs and ultimately lead healthy lives. And so we are so great to partner with these types of organizations to get that word out there. We do many things within the communities and just trying to get those beneficiaries ahead of the game. They need to understand that this is a benefit that they have available to them, and it's a great benefit. So definitely love the collaboration with organizations like yours.
Absolutely. It is a great collaboration. I'm thankful, grateful for it. And also just because again, it's about getting the information. I think I shared with you before we went live is just talking about how, when you are in these meetings, you're getting all the information, and how does it get down to everybody? How does it get to my neighbors? How does it get to, those that are in the community? And so I think that's why it's so important for me to have Tea with Ty, and I'm so grateful to have you on to share this information, because a lot of times, yes, there's packets of pamphlets and paper and there's tons of information, but sometimes it's just, how can I easily just spend a few minutes and get the good tea, right? Get the good tea on the information. So I'm so glad to have you here to provide us all of that good information about our pharmaceutical benefits as a Tricare beneficiary. So thank you so much for that. Is there anything else that you'd like to add, Rochelle, that we haven't quite kind of discussed?
There was one thing I do want to add. There is another great tool that is available to the beneficiaries, and it's our mobile app. So our mobile app will help you track all your medications. You can refill. You can add your medication to auto refill. So it's a really good tool. It's another tool that you can have in your toolbox to really help you stay adherent to your medications and get those medications when needed. You can also review any vaccinations that you received at the retail pharmacy. It holds all that information, and that app is available through the Apple App Store or the Google Play Store.
That's really cool. I need to add that to my phone. So how do we search for the app? What's the app called?
It is the Express Scripts mobile app.
Okay. So Express Scripts mobile app. So make sure that you guys download that and utilize that. They'll probably come in handy, especially if you were taking any of the trips or on the road. And I mean, who carries a packet of information now when you have your phone? So
Absolutely.
if there's an app for that, who needs Google? Just go to the app.
For sure.
So there's that. Yes. And the website, one more time, it is the express-scripts.com/TFORM. So TFORM. So make sure you guys check that out. Thank you so much. It's really good.
Thank you.
So, and I'm always impressed and pleased to learn about our military families that, not the military families. Sorry, my sisters are calling me on my Facebook portal right now. I keep turning it off and it keeps calling. Thank you, Facebook. So it helps us to connect, because it is about connecting, but really it's about looking. I love seeing how our community is strengthened, because we have members that are part of our civilian neighbors, right? That are not military. You don't have the military background, but here you are loving and serving, and supporting our military families. And so I just want to say that personally, as someone who's military girl through and through, I love seeing that support, and it really does help make an impact for our community. It helps it make it stronger. So thank you for your support, and just for, for hopping on and caring to share the information. So
my pleasure, for sure. I've loved talking with you today. Like you said, just getting the information out there to people who wouldn't normally get that information is just a great thing, and just arming them with all the tools that they can have to you know, stay healthy, maintain a healthy lifestyle, and, you know, live a long time.
Absolutely. Yes, yes. And to live healthy and just, and have that joy, because we know
Absolutely.
military lifestyle can be a little bit stressful
Yes.
for all family members. So I love that message and your mission kind of ties into that, so the health aspect, the whole
Absolutely.
ensemble. So that means we'll probably have to have you come back so we can talk more about that. So
Sure. Anytime.
so I'm so glad. And now I wanted to kind of switch and just say, if you are not a member of Blue Star Families, please make sure you go to bluestarfam.org. And it doesn't matter if you are currently active duty, if you are a veteran member, if you are a spouse, if you're a caregiver, if you're a dependent, if you are not affiliated whatsoever, you can become a Blue Star Families member. Just go to that website down on the bottom, bluestarfam.org, and hit the join button. We have a lot of perks and programs and all kinds of good things because we want to do what we can to help you have a strong community wherever you are. Specifically those in Missouri, because that's where I'm at. So, here I'm a little partial to those in Missouri, but Blue Star Families is a national company. So we have 11 chapters. So nationwide. So I thank you all for joining today. I hope that you walk away happy knowing that you've got 5 pharmaceutical benefits that you can share with others that are Tricare beneficiaries so that they can have this good information too. Or you can also make sure that you like, comment, and share this video. So make sure that you share it with those so the word gets out. Don't just, sit there and get it all and then not use it and not share it. So those 2 things, always use it, always share it. And again, Rochelle, thank you so much for joining us. I'm so glad that you joined today. Definitely, if I'm ever in Arizona, I'll have to kind of call you for some things to do since you'll probably know like the whole rundown being born and raised there.
Absolutely.
So I am Ty Kimes, your Missouri Blue Star Families chapter director, and I am signing off, doing my best to tie you to your community. Thank you all for joining and watching. See you next time. Bye.